Introduction. We understand small businesses don't always have the time, resources or expertise to manage health and safety in their workplace. That's why we have developed the easy-to-do Work Health and Safety Toolkit, making it easy for you to understand and meet your work health and safety obligations. Today's session runs you through the 7 components of work health and safety to help you create a safer, healthier and more successful business. Your commitment, consultation, managing risks, reporting, worker capability, safe working environment, and workers' compensation and recovery at work. Your commitment. Commitment means leading by example with your actions and attitude to develop a successful safety culture in your business. How do you demonstrate that health and safety is a priority? Talk about it with your workers, supervisors, contractors and visitors. Lead by example. Participate in safety. Participate in safety training. Attend safety meetings and wear personal protective equipment if required. Don't take shortcuts. Always follow your work health and safety procedures. Encourage workers to talk openly about work health and safety and give positive feedback for good safety performance. You can show commitment by building health and safety into your business plans, making sure production demands don't override health and safety, making health and safety the first topic at team meetings and toolbox talks. Clearly communicate all health and safety responsibilities to your workers, contractors and visitors in your workplace and make sure you fix any health and safety issues promptly. Consultation. Consultation is an essential part of managing work health and safety. It is a two-way conversation that uses everyone's knowledge and experience to build a safer and healthier workplace. You can consult with workers in a variety of ways, including holding regular meetings, electing health and safety representative, known as a HSR, forming health and safety committees. Good consultation means your business has agreed consultation arrangements with your workers and you tell them about consultation outcomes. You consult with your workers or their representatives when identifying risks or hazards in the workplace. You consult with workers before making decisions that impact their health and safety. You have regular, honest talks with your workers about the consultation process, how it's working and how it could be improved. There should be good representation of all workers in the consultation process, including diversity of their age, ability, language or literacy. Workers suggest and support timely improvements that benefit your business. You consult, cooperate and coordinate work with health and safety activities with other businesses that have shared duties. Your workers are affected by your decisions, so you must involve them in all work health and safety decisions. They can help you identify better controls, improve decision making and reduce incidents. Managing risks. Managing risks is an ongoing process of identifying, prioritising and controlling anything that can cause harm. You must find out what your health and safety risks are, particularly those that could cause harm to your workers. Remember that risks are caused by hazards or situations in the workplace. Take regular walks around the workplace and look out for potential hazards. Use the right controls to eliminate or minimise your risks and protect your workers. Good risk management means your tasks, items of plant and workplace are designed to be safe and effective risk management processes are in place to identify hazards and control risks. High-level controls are used to eliminate or minimise risks. Controls are checked to make sure they don't create new risks and reviewed regularly. Workers are consulted throughout each step of the risk management process. Workers understand the risks and control measures. Reporting. Reporting gives everyone the opportunity to raise health and safety incidents and issues for you to action. Talk to your workers about developing or reviewing a reporting procedure. They witness most of the health and safety issues in your workplace, so can help make sure the procedure suits your business. What to report: injuries, illnesses and fatalities, near misses, damaged or faulty equipment, housekeeping issues, health and safety hazards, suggestions and improvements. Serious, life-threatening hazards must be reported immediately to the business and the regulator. Call Safe Work New South Wales immediately on 13 10 50 if there is a death, serious injury or illness, or potentially dangerous incident. Workers can raise health and safety issues by talking to their manager or supervisor, completing a hazard incident report form, raising it at a team meeting, raising it directly with a health and safety representative or HSR, or using the default issue resolution procedure. Good reporting means systems and procedures are in place for reporting safety issues and incidents, and workers are trained and instructed on those procedures. Health and safety issues and incidents are always reported and acted upon. Risk controls are always reviewed following an incident. That you notify Safe Work of a serious incident, near miss or fatalities. Reports help you identify trends, priorities and prevention measures. Worker capability. Worker capability means the worker has the ability to perform the task expected of them without risk to health and safety. Induct workers before they start work. You must give new workers training to help them become familiar with their environment, the tasks and the people working around them. This is called induction training. Provide information to suit individual needs. Make sure everyone has the right information, and training depends on a worker's duties, skills and expertise, the hazards and the control measures in your workplace, the worker's health and safety responsibilities, e.g. if they're a supervisor, first aid officer or health and safety representative. Make sure every worker demonstrates they understand their responsibilities. Make sure your workers are trained and compliant. This includes training, assessing your workers' competence, checking their licenses, keeping records of training, reviewing training, and making sure it's up to date and working well. Provide the right supervision for the workers, and supervising workers, make sure your systems and processes are followed correctly. Good supervisors help improve productivity and maintain healthy and safe workplaces. Safe working environment. A safe working environment means designing and maintaining your workplace to minimise physical and mental health risks. Make sure the design and layout is safe and meets the business needs. Maintaining a healthy and safe workplace by cleaning spills immediately, providing adequate lighting, ensure adequate ventilation of the workplace, keeping the walkways clear, storing materials neatly, removing waste, replacing consumables like soap and toilet paper, keeping electrical appliances in good working order, replacing damaged furniture, fixtures and fittings. Check equipment by ensuring it is fit for purpose. Test it and consult with your workers to make sure it won't introduce new problems. Many chemicals used for commercial and industrial purposes are dangerous to human health. Identify all harmful substances, materials, and prevent or control exposure. Poor mental health negatively impacts your business and your workers. Protect your workers from mental health risks at work. Identify emergency situations and plan your response for each. An emergency may be fire, explosion, gas leak, chemical spill, medical emergency, or natural disaster, bomb threat, or violence. Give workers access to first aid equipment and facilities, and make sure first aid kits are close to the areas where there are higher risks of injury or illness, such as the kitchen, a warehouse, and inside all work vehicles. Workers' compensation and recovery at work. Understanding your workers' compensation obligations will assist you to support your workers to recover at work following a work-related injury or illness. You must have a workers' compensation policy that is right for your business. It must reflect the number of workers, the wages paid to the workers, and the type of business you run. Let your workers know what to do and who to contact if they get injured at work. Report injuries and illnesses to your insurer, who will give you a case number that you can provide to your workers. Keep a record of all injury and illnesses, even minor ones that don't need insurance claims. You must have a return to work program within 12 months of becoming an employer, and it must be developed in consultation with your workforce. It should outline your procedures for handling work-related injuries and illnesses. You or the return to work coordinator should have regular contact with your worker after their injury or illness. Stay connected and focus on their recovery and return to work. Together with your worker, plan the tasks they can perform safely until they can resume their pre-injury role. Conclusion. Now you know the basics about creating a safe and healthier workplace. You can access the full, easy-to-do Work Health and Safety Toolkit on our website at www.safework.nsw.gov.au/easy WHS. The toolkit includes checklists to help you understand how you currently rate and any areas you can improve on. Our website also has lots of information and free services you can access for help.